All right, so what I'm going to demonstrate today is carpal tunnel adjustment, one of the easiest treatments that I have here in the clinic. And success rate is 99%, probably close to or plus. So when we look at carpal tunnel, we're talking about an area where the four bones of the wrist, there's 8 of them actually, but we're going to be dealing primarily with the 4 in the front. They create the canal by which the nerve runs through, that with some tendons. And of course on the top of the wrist here, there's really nothing but tissue. So there's nothing on the top of the wrist that can actually impinge the canal itself. It has to occur from the backside, which are going to be these 4 bones. And what they'll do is they'll simply shift and rotate into the canal. That will cause a pressure on this yellow nerve you see here and causing an impingement. So of course, this thing shifted and rolled in, so the easiest way and the most common way that makes sense to me is just to adjust it and align it back out of the canal. No surgery, nothing invasive. If it wasn't there 2 weeks ago, last year, or whatever it is today, the simple thing is just to correct the alignment. Now, surgeons will come in here very often and either shave this bone down or remove it. Well, that's a little too traumatic in my book. So what we want to do here is just perform this simple adjustment, correct the alignment here. Now, most chiropractors, sadly, don't address extremities. So find yourself a qualified chiropractor that performs these adjustments and get rid of your symptoms and your pain and your problem very quickly, effectively, and without the need for something as traumatic as surgery. So I'm going to perform the adjustment here very quickly and show you how this is done. So with this, I'm going to find the vertebra in the center, the 2 bones in the carpal tunnel canal, adjust them out and correct it that easily. Okay, we're done. Move on, fix it, find it, leave it alone.